done, secondly, by a nurse to confirm the diagnosis and begin treatment, instead of doing what we're now doing, which is, in the best of cases, the community worker detects its high blood pressure, sends them to a health center. The blood pressure is taken, it's still high, but they're told they have to have at least 2 visits, come back in 15 days. And when they come back in 15 days, they take the pressure again and it's high. These are all lost opportunities because half the patients won't come back. They have no time, particularly in vulnerable areas or the informal workers. They can't leave their jobs for us to take 3-4 visits weeks and weeks before we diagnose high blood pressure and provide treatment. So confirmation that this is happening must take place at the health centers. Andres, now, why don't you see how your country stands in this area? Let me, in the meantime, invite Caro Moreira. She's a nurse, high quality nurse. I think I can say this. She's the director for non-communicable diseases at the Ministry of Health in Chile. And they have prepared the first formula documents to allow the use of these drugs. Hello, good afternoon here to everyone. Well, we this year move forward to including pharmaceutical drugs with legal support to intensify treatment. In 2021, we added nurses as the legal support, but it was still in standby because we still need to have some changes in the pharmacy computer system to actually make the strategy operative. This year, we had the Secretary of Public Health, where people from their staff worked with in the division responsible for pharmacies. We had Marcela Rivera from DIVAP and DIPRESE, which is us, public health. We brought together a bunch of the most important stakeholders to make a decision.
We achieved the legal support from the ministry, and what we're doing now is to put the strategy into operation and change the electronic score systems so as to generate a recipe with the non-medical professionals helping us. So that's the process. It's taken us over a year because the decision was made to not launch without having the legal support, not launch a strategy until we had the means to do it. We are going to start with a pilot in a health center. We have 29 of these large health centers, and we're going to gather and we'll see the barriers and obstacles in order to expand it countrywide. So hopefully next year it will be fully operational, both for nurses and for pharmaceutical clinicians. Yes, this is an intervention, says Pedro, one that is working the best in whatever environment it's been tested. This intervention de facto has the multiplying effect for the diagnosis and the treatment and improved control levels. So let me say that Chile deserves a round of applause because it's one of the first countries in the world that is at the forefront, not only for what we're doing in hearts and for cardiovascular disease, but it might be a model for other things. And actually, it's what we're doing. It's how we're doing it in many countries, or how we follow pregnant women, for instance. I recall, for instance, in Costa Rica, the primary health cares, and I don't recall what their name was, Atar or something, they can go to the houses, look at the woman, the pregnant woman. So we are subusing a lot of all of this, and see how everything is interconnected. Andres, you recall statin and primary healthcare. No, statins can't be provided by healthcare, but we need to make it in an easy way. It cannot be put into primary healthcare. Primary healthcare needs to have a certain specific medicine and not others. That used to be the heart's concept, but now we're saying that only the super specialists can manage it in the case of the hypertensive patients. But with the figures that we've heard for Esteban, we see that strides have been made. This is a quality standard. And when we spoke with the group, And when we were in touch with the countries, we said that this is a standard, we're at a 50%, but things were so not working well that we needed to start with 50%. The gaps that we face, the resistance in many countries is extremely high. So let us move to the seventh